Okay.
Hi, everybody.
Hi. Hello. Which
waiting
way are
for
we looking?
somebody to come back.
Where do we look over
Hi.
here?
Yeah.
Okay. We got a few cameras in here today, so we're trying to find the right one to say hello.
I think we have Sylvia and Monica on, and we might have a couple other people.
Oh, okay. Great, great. Well, we're looking forward to this today, and we're going to go through two peels using some of the acids that you have. And the first one that we're going to do is we call this our TCA Salicylic Paramedical peel, and it is a 3-layered peel, and it gives you a pretty good depth of exfoliation. Have you explained to them the depths of our peelings, how we refer to that? So this is one that we would say is an aggressive mid-depth peeling, and it can cause the skin to have a lot of good cell turnover. Now you are able to chat with us, so if you have anything you want to pose a question to, we are watching that, and we'll try to then respond to something that comes up. Can you hear us well? Could you maybe acknowledge on the chat and say that you can hear us, and we'll make sure that's working.
And also maybe want to tell them that this is equivalent to the baby boomer. We might add another layer of acid to make it a little more aggressive, but it's a very similar peel.
Well, it's actually the same peel.
Right.
We just did this for the medical. I was using medical terminology for you, but this is a popular peel that we call the baby boomer. And so if you're talking to your doctors, you might want to refer to it as a paramedical TCA salicylic peel because they relate to ingredients, but we call it the baby boomer because it helps all us baby boomers look younger. So we have our model on the table. She's a perfect candidate for this peel. And we're going to begin with the cleansing. Now, I don't think you've talked to them about this cleanser, have you? So you don't have this. This is a cleanser that I feel would be really useful for you. I guess first what I'll do is just a damp cleanse, or damp with the gauze. But, so we're folding our 4x4s. This is the method we use. I don't know, are they seeing this okay?
Yeah.
This is the method we use for, applying, removing, so forth, holding the gauze. And so I'm going to just moisten them with some water so that they're not drippy, but they're pretty moist. Come across the eyes. And there's nothing on her skin, nothing on the skin. This is just water. And just doing that to get a little moisture on the skin of water and just to take off this surface. And then you can flip your pads over to use them when you actually remove your cleanser. So then I'm taking a little bit of the Maui Cleanser. Lynn, you want to talk about this one, or would you like me to talk about this one? Because I love this cleanser. It's definitely one that we put into that clinical cosmeceutical category. It's one that would fit well with a doctor's office for sure. It's our stronger cleanser that is medical, professional only. We don't retail this cleanser. And it has a high percentage of lactic acid with a pretty concentrated pineapple base with that pineapple enzyme extract. And that's why we call it Maui, because it has a really good scent. But getting this worked into the skin and concentrated, I haven't even really lathered it up and wet my hands yet.
It's equivalent to about a 15% lactic,
Okay.
and it has a little bit of shea butter in it as well. But it's a really nice one to give a good, thorough removal of oils and give you a good prep prior to an acid peel. It's also excellent for a body peel. This is really great for doing body treatments. It's got that added acid content for that tougher skin. I love this one.
Yes, this is great. And anytime you want to bump up your clinical peels, this is a step with the cleansing that will give you that extra boost. I mean, choosing a cleanser for a peel in a protocol, we sometimes will say use pumpkin, sometimes we say glycolic herbal wash. I know Lynn has gone through the cleansers. We might use beta green tea. You can select a cleanser based on the skin you're working on, based on the depth of peel you're doing, and just how much defatting that skin needs. And so when you're wanting to get the most, and it's a skin that can handle that heavy degreasing, the Maui Cleanser's the one I would reach for. The only time you wouldn't want to reach for that is if you have a skin on your table that is very AHA sensitive, because this is going to really bring that out.
Go for the gusto.
Yes, go for the gusto. So that's a pretty good lather and rinse on the skin. And so now we're going to go back to our 4x4 gauze, and we're going to go ahead and do a removal. I like to always start at the eyes, just in case any of the cleanser has gotten in that area. I can wipe out and away, and that makes sure I don't get anything in the eye area. So now we're going to begin removing the cleanser and the surface residue on the skin. And I don't know what your visual is like, how clear you have it, but she's already pinkened up. Is that showing on the camera?
Yes.
Lee, on your end, on our end?
Yes.
Okay. You can see that she's really getting a little pink, and this is okay. This is what happens to the skin when you start working in a more stimulating way. Firm pressure to remove it. And we're going to go ahead and dip our 4x4 gauze back into some water and give another rinse. The reason we like working with these gauze is they're sanitary, good hygienic tool. You can see what's coming off the skin. You can tell exactly how clean you're getting the skin. I just think it's a good tool over sponges and cloths, and so we really teach this way for our removals. And one of the things we teach too is when you're doing this, you do a couple rinses until you don't see any more residue coming off of the skin. Now sometimes the skin will require a second cleanse, but because of the peel we're doing today and the next steps, we're not going to use the Maui again. We're going to do another phase of cleansing. And I know Lynn's talked to you about all of our cleansers. We're big on cleansing around here. We really feel like this is the first step to get it going and get the skin prepared and get that nice clean palette. So, and if you see some, I don't see anything, so no. But my eyes are failing me these days. Okay, so what we want to do now, do they have these all-purpose cleansing pads?
No.
Okay. Well, you know, kind of maybe don't want to introduce everything that you don't have. It's just that for this depth of peel from kind of a cosmeceutical or medical place, they can make a good second phase cleanse. Now you could use the glycolic herbal wash, you could use the pumpkin, and you may not even need to go back and do a second phase cleanse. Going back, feeling the skin, seeing how slick it is, you want it to get dry. What are you looking for?
They ordered the fruit acid botanical, but it's probably packed up from our class.
Well, we're using the 20 lactic on the. Well, yes, Lynn's mentioning that you do have the fruit acid botanical. That is different from the pads. These pads have salicylic in them. Okay, looking here.
Yeah, look at the camera.
We forget, we didn't realize where you were. These have salicylic in them. They're antibacterial. And so that makes a good tool if you have a skin that maybe does have some bacteria on the skin. Now, it's not really so necessary with Susan. I think we're just using it to defat a little further, just to get a little bit more lifting of oils on the skin. This will also stimulate her. I'm doing firm pressure. This, you know, you want to get in there and really lift away. I like to hold the skin as I'm going, coming down with that real secure pressure. And you don't have to use gloves at this stage of the treatment unless you're working with a skin that has some open wounds. Then I would recommend that. But as estheticians, do they call themselves estheticians?
I think they're
cosmeticians, what
Kind of in between. I
know what
think.
your title is, but what, as professionals that work with skin, we love to touch the skin. And when you're touching the skin, you're really able to feel and get a sense of what's going on with that skin and if you've gotten it really good and clean. And this really did make a nice difference in her skin, just this little wipe. Because now I'm going back and feeling again, and it's got a real slickness to it. And that's what we want to achieve. So that's our cleanse. Real easy two-step. We did the Maui Cleanser, really work it in 3 to 5 minutes. Rinse the skin thoroughly. Make sure there's nothing left on the skin. You can do a wipe away with the pads. If you needed a little deeper defatting, you could use your fruit acid botanical that you have. And we may show you how to use that today, maybe in the second peel. We'll be using that later. Now, we're going to go ahead and I want to put on a glove because at this point when we start to use the acids, we want to wear our gloves, and we're going to put eye pads on our client. So, yeah, these. Oh. Thank you, Lee. I always recommend to your clients, your doctors, that your nurses, estheticians, to put eye pads on someone when you start to work with the acids. It's just a real important step so that you're real ensured that you're not going to get anything obviously in the eyes. And so once you've got the pads on, the hair's covered, we've got our glove on, we're going to go to our step of acids. And do they have this protocol in front of them?
I sent it to Sylvia yesterday, so she's got it in her email.
Okay, so Lynn says you have this, Sylvia, that you had it in your email. And so if you do have the protocol in front of you, it may help you to follow this. And the change in that is we did the Maui Cleanser instead of the Pumpkin Cleanser. And we'll go back and review this with you, just so there's clarification. So now we're going to apply our 20% lactic acid. This is a great tool to use for further defatting and prepping your skin. And our 20% lactic is a pH of 2.5, and we like to apply it with our 2x2 gauze. And so we've poured, Lynn actually did this for me, she poured the acid into the glass beaker, and I'm going to dip this in and get it pretty saturated. And you just want to make sure that you have enough on your gauze. I don't know, can they see this?
Yes.
Okay, enough on your gauze to be saturated, but you don't want it dripping. So make sure that you know, anything that might have possibly come off, you want to make sure you've got good control of that. And now to notice our client's skin. She's got even pinkness all over, a little more erythema on the neck, but other than that, nice and even stimulation going on. So now we're going to apply the 20% lactic starting at the forehead and just smoothing it in evenly. Now, whatever pattern you use or you teach for applying the acids is fine as long as you do it the same and evenly. So the goal is to always make sure that you cross back over enough to get every bit of the skin well saturated. And because this is an alpha hydroxy, our pressure is not as much of a focus as it is just, it's a firm pressure, but we're just really evenly applying it all over, getting it on the skin. Now, Susan, can you feel this?
Oh, it's not bad at all.
Is it a
It's
tingle?
a little tingly.
Okay, so your clients will feel maybe a slight tingle with this. We don't consider this a hot acid or a hot step. However, this is such a good tool, and I don't suppose you've had a chance to talk about this.
Yes,
Oh, you have?
yeah.
Okay, then you've told them all the ways that you can use this. I mean, there's so many ways to work with this to get a good outcome on different skins. From the way we are here, like for 2-3 minutes as a prep, even just on and off as a slick removal for picking up some extra oils on the skin, to mix in an enzyme, to mix in a mask, to boost, a preparation that you're working with. So there's just a lot of use. A cleanser, a lot of times we'll put a little 20% lactic into, say, the pumpkin cleanser, and that will really boost that up a little bit more, and you get a deeper cleanse. So this is a good tool for all of that. So I'll throw this away. Yes. So like I said, this is only on for 2 to 3 minutes. I'm watching her skin. She's just getting a little more pinkness. Sometimes I'll go back in with my fingers. Now, if your fingers are sensitive and you're doing a lot of these, it may dry your fingers off, or dry the tips of your fingers. But I like to go in, smooth it in some, feel it, make sure if there's any coarse areas, like here, I want to kind of work it a little bit. Nose, maybe I'll go a little bit more. And then you just make sure you rinse your hands good so they don't dry out. I actually like it because it makes my hands soft. It feels good. So I'm going to go ahead and rinse my hand. No, we don't need that. Okay, so we'll go ahead and rinse Susan's skin. And don't let me forget, I'm actually going to show them how to use the, well, I don't know if I can do it in a minute. I was going to do it on Liz, the rough gauze.
I think that's a good idea, considering what you've told me.
Yeah. Did they chat with you?
No, they haven't said anything. I'm asking questions.
You want to go check on them and make sure they're on? How would you know?
I don't know, did they reply to our initial?
No,
They haven't replied to anything. We might be talking to.
Well, we're recording it, right?
We're recording it,
Yeah, let me go check.
so we'll check. While Lynn's checking to make sure if you're all out there, we are going to remove this 20% lactic. And so this is the one that doesn't require full neutralizing. Just rinsing it with water, warm water, is enough. And flip your gauze over, do another rinse. Make sure all of this is off the skin really, really well before you go on to the next step. There I am just getting the dirty water. So now what I need is the TCA. I think for this I'm going to put on 2 gloves. So now we're going to start applying the acids, the TCA salicylic acid. And note again, her skin is so nice and evenly pink. It's real dry, and you want that. You want a very dry skin so that it's absorbable. And Lynn has poured some of the TCA sal into a beaker. And I'm going to do this first layer a little more aggressively to open the skin and have it kind of ready for my second layer using a rougher gauze. The rough gauze are really nice when you're trying to get depth out of your solutions. And so I'm going to dip it into the TCA salicylic and let that completely absorb up everything. Oh, and can you put my glasses on me? And put the light on them. Forgot to put my glasses on. That's good. Mm-hmm. Perfect. Because you want to take a closer look at the skin and really be watching as you get ready to do this. And so I'm starting at the forehead. Watch your liquid. You can see how wet the skin is at this stage, so watch that you don't want it dragging. See how immediately pink the skin is? When you get around this area, change your format a little. But then as you're coming around here, I like to cover the ears. Now this is pretty firm pressure. And this is pinkening her up considerably. This rough gauze with this TCA salicylic solution really makes a kind of a bit of an opening in the skin, if you will, to get that good depth of penetration for you. Now you don't have to do this to get a good peel, but it's a good medical technique that a lot of times physicians like to use. And I'll even go if the skin is firm enough and I can get a good hold, I'll do this circular movement to drive it in. How you doing, Susan? Let's give her the fan. That's a real good idea. She forgot.
How's the intensity versus just using the nozzle?
You can tell the rough gauze is really getting it into the pores.
Well, you can see on the forehead. Yeah, but see, I'm still dripping. If you can get wet, which is what you want, and that's something to really pay attention to, is your depth by how much solution you have on your gauze. If you have more here and less here, you're not going to get an even peel. So I'm always watching to see if I'm getting that same wetness, which I am. All the way around, she's got that real wet look to the skin, and I'm letting the skin take that in. And so she's already beginning to frost. Frosting is, we also call that blanching. Blanching is a separation of the stratum corneum and the upper epidermal level, and that transepidermal separation is telling you that that's enough. That's a good signal. That's a signal to pull back, let the skin do what it's going to do, then reassess in a moment, let the skin take it in. You want to make sure you know a true frost from just a frosting of the acids themselves. Sometimes they powder up. Salicylic can do that. So you want it to be a true frost on the skin. And with Susan, she's got some areas on the forehead that are really pulling up in that frosting or blanching that we like to see for a deeper peel. The only downside to this method is that it is difficult to get that real even peel that we like with our solution, but we're going to pick that up on our second layer, and that's going to get us the full evenness, because we like to have a very even outcome, obviously all over, all the way to the hairline, feathering out at the neck, you know, to the ears, and so we just want to make sure that we accomplish that, and we'll catch that with our second layer, if indeed our skin wants a second layer. So we watch and see. Take a breath, a couple breaths, deep. Tell me your intensity, 1 to 10.
6.
6. So she's feeling this acid quite a bit. And remember, salicylic and TCA are both very hot acids. They're burning acids. And so someone is going to definitely feel this. But not so much so that you need to medicate someone. I don't think you need to numb the skin. Most everyone can tolerate these for a few minutes until it begins to find its end point, because these are self-neutralizing, and so they will stop working. And in fact, her skin has pretty much taken in all of the solution. You kind of watch to see if you have any wet spots. If you do, then you want to let that absorb. You don't want to keep applying acid if it's pooling, because then the skin's not taking it in anymore. And so it's good to let it finish doing what it's doing. And so then you have a decision to make. I mean, she took this first layer. This is only one layer of our TCA sal with a pretty nice prep. And we know we're going to finish her with our vitamin A peptide peel, which has a lot of power behind it. And so then you make the decision when you're looking at this, should I do one more layer and make it a 2-layer TCA sal? will I be able to do the 3 layers? Because we recommend anywhere from 1 to 3 layers with this step. But you really watch the skin and you let that tell you what to do. And if she has a full enough frost all over, I might say, you know, this is enough, and we're going to now just top her with the vitamin A peptide peel, which in itself gives a very good support for cell turnover. But she's still taking it in a little bit. Tell me the intensity, Susan.
It's no worse. It feels like it's calming down a little bit.
Okay. So it is beginning to calm down just a little bit, right?
Frost on the left.
Some, yes,
Oh, yeah.
She is. Nice little bit here and there.
How deep you want to go, Susan?
Right here.
Layer it up.
She wants deep today, so I think what we're going to do is take our oh, okay.
Sound like
That's all right, we'll use it. So what Lynn's going to put a little bit more of the TCA salicylic peel solution into a glass beaker, and then we're going to apply that. Now you have 2 choices here of how you want to apply your solution. A lot of times you'll see me applying it with a 2x2 gauze, and this is a really good technique. It's the way I did the 20% lactic earlier. Or you'll see me dip my brush in and apply it with the brush. You want to use a really good brush like this. Our brushes, I think, are excellent for this because they're nice and firm and they hold the solution, and so it's not going to drip. You're going to have complete control. The advantage to this for at least 1 layer is it allows you to get a more concentrated amount into the skin. This is great for a couple layers and nice, even, and pressure. You don't need as much pressure with the brush. You need more pressure with the gauze, depending on what you're trying to do. So sometimes I'll go 1 layer with this and then come back and do a layer or 2 with my gauze. We did the first with a coarser gauze to get her more stimulation and opening to the skin, and you can see that worked very well for a deeper peel. We don't recommend this for every peel in every setting. Sometimes it's fine just to go with either one of these and it works, gives a great peel. But again, in your medical settings, I think they find this a good step with the gauze, and that's the difference, using this very rough, coarse gauze to put your solution on. So I'm going to do, she wants a deep peel, and she's going to get a good deep peel anyway. And they're all going, yeah, she's going to get deep peel. Now some of this is not true frosting. Some of this is powdery residue of the solution. This in the forehead is definitely separation, and particularly the whiter little spots that you're seeing. So I'm going to go ahead and do another layer with the brush, and we'll see how her skin takes that in. I'm only going to do 2 though. We're not doing 3. The only reason you would do 3 is if you saw a skin that wasn't showing you any signs of frosting, then you would. But we typically would say, you know, to stop at this step. So I'm going to kind of come around to a pattern of where she didn't pull up as much, and this area here where the skin is a little more tissue, and she also has pigmentation over here too. And I'm going to take it in around this pattern first and let that get saturated pretty good. Another little dip. This is like layering a cake, frosting a cake. I like this step. I don't think she needs much on the neck. And be careful you don't overload the neck with acids, because we're going to put the vitamin A, and that's going to give her a really good peeling. So we've gone around and kind of captured this outer parameter where she didn't grab as much with the frosting. Also going to go across this nose area. This is just a way to kind of even the skin up and look at it again and see how she looks, and then see how she feels on that. Can you feel that solution?
I'm starting to feel it on my jawline.
Okay. So now we're going to just give her that little bit of over. And when they start, watch your client, when they start moving their feet and shaking their feet, that tells you they're hot. And you see I'm kind of spotting it in because I can just see some areas where there's that true deep frost, and then I see areas where we could still get a little penetration because I don't want to overdo it. Here she's very pigmented. She's very fair, and she gets freckles. And so we want to make sure that we can get a good lifting here in this freckled area. Now across the lip, this is an area where a lot of people obviously show their age, is with the lip lines. And so the brush is a very good tool, or going back with a cotton swab and getting in here around this lip line so that you capture all of those fine lines. And same thing for the eyes. If I didn't see a good frosting around the eyes here, which I am seeing, I would go really back and get this crow's feet area, open it up and go in there, but we don't need to do that. Kind of showing you just some spot applying with your brush just to get that solution in there in some areas where she could use some more. How you feel?
Fine.
Okay. So Lynn, what do you think? Does she look good?
Are we gonna do melon suppressant or no? It doesn't call for a
Yeah. Yeah, I don't think necessarily I would do the melanin suppressant.
What's this doing over here? So
I'm just wanting to give her one more little wiper
Yeah,
here.
load her up. That's just me. But, you know, we also know that Susan can handle a lot. She's had a lot of peels, so if you did the rough gauze on me, I'd probably fly off the bed, so.
So that's starting to bring it up. But we first went here to see what we could get here and to see, because you notice her color's even different here. And that means a sluggish circulation in this region. And she doesn't have as much blood flow here. And this is not, taking in the acid quite as much. And so you kind of watch that area and see if you want to go a little bit more. At this stage of your acid application, you really are kind of selectively going back and watching to see if there's some areas that you want to take in a little bit more. But sometimes that second layer, like we just did, just is a nice topper. Now she's getting that good full even that I wanted to see all over. Before it wasn't quite as complete. Now look how it's pulling up everywhere, and she's getting that full frost. So I'd say she's pretty cooked. I'd say she's pretty good. How you feeling, Susan? Where are you? What number?
Still good. Maybe 7.
So she went up a notch. She was a 6. Now she's a 7. Remind them to breathe. Hold that fan. They can bring it in close. It's kind of good at this stage to put your hands on your client. Work the shoulders a little bit. This really helps to take their mind off of that. Also, you notice with Susan, we have her in a semi-reclined position. She's not laying flat. That helps to keep the blood flow from going to the head. It also really does lessen the discomfort or intensity of the solution. And so that helps a lot. Now, once this is fully absorbed and neutralized, which it really is at this stage, I'd say she's really taken everything in, we're going to go ahead and apply our last step of the peel, which is the vitamin A peptide. And this on its own is a beautiful formula that can give great cell turnover to the skin. I love this vitamin A peptide just to do like 3 in a row, one every 10 days or 2 weeks. And the skin gets a great exfoliation, but a lot of good toning and firming, and it really softens the lines. And so when you top it on an acid layer like this, it's just going to take that peel a bit further, but adds the refinement to the peel that brings in that toning, firming aspect to it. Anything you want to say about the vitamin A peptide?
I just think it has a really great lifting quality to it, so it's a nice topper for that. Pretty much said it all. I don't like to use the droppers with the vitamin A. I just kind of pour it into the bottle because it gets stuck in the droppers and it's messy to clean. So you need to apply it with a brush or with your fingertips with a gloved hand and just massage it in.
Mhm.
but I don't think they get a lot of activity out of it. She asked me if we could really work it in with firm pressure massage it in.
This,
Yeah.
it's not necessary to do that, but when you're doing it by itself as a serious treatment, I think it is fine to go ahead and massage it in and work it in. I've even done a little wet heat on, when I've done just that. But like today, you wouldn't want to do that. You don't need to add any heat to this. You don't need to massage this in. It will go in well enough on its own without you having to do anything else to it.
That's kind of what I told her. I said, work with it first and see what it does. But it's pretty active on it, so.
Mm-hmm. Oh, there's just so many wonderful treatments that you can get using this vitamin A peptide. And I really like to focus around this eye area. You notice I keep the eye pads on, though. We're not going directly under the eye. Sometimes in a medical setting, and the doctors want to get in there and do that, that's one thing. But we really teach our professionals to kind of keep in this orbital area, getting those crow's feet, and that's it. So I think we got it on good enough. I mean, I was just using up what we have here. How are you feeling, Susan?
I feel fine.
Did that take it down any?
It actually did. It's a little cooling.
Yeah, a lot of people will say that when you put this A on, that all of a sudden their skin feels a little more calmed or not as intense. And we actually had more in here than we needed, so it's good to let you know that. You don't need to do as much as I'm doing. I'm just kind of finishing up using it because it was out. But you need to have enough just to get a nice even covering. And Lynn mentioned that she doesn't like to use the dropper, and some people don't like to use it. Depends on how well your dropper's working for you, because sometimes depending on how you're holding it, you get it in there and you get it. But if you did use the dropper and you put it in there and you pulled up the solution, you just put a drop on directly onto the skin, and it's about 4 drops. And then you take and smooth those 4 drops in with your fingertips, or you put it into the beaker like we did. It's sometimes a little hard, though, like she said, to get it out, or it's easier just to pour it. And so I think that's fine either way. So she's pretty well done. I'm still looking at her through my magnifying glasses, watching the skin just to see overall how she's looking. She's pink, she's stimulated, she's frosted. She looks like she's really had a peel here. And I'm just going to kind of let everything absorb and soak in. And I'm going to tell Susan not to do anything to her skin until this evening. She really could do nothing. She could just kind of let it even go till tomorrow, 24 hours. And then in the shower, she'd get in the shower just a cool rinse. She doesn't have to do any cleansing. But if tonight she wanted to just kind of put a little bit of water on the face to take some of this vitamin A, if there's any residue left, like if it doesn't totally all absorb in. If you have them have it on for a good 8 hours, they're good, but sometimes, I do it, I just go to bed with it, and I'm fine, and I don't even try to take any off. But if there's quite a bit of residue still sitting there, then it's fine after 8 hours to go ahead and, take that off a little bit. The less you do, though, for this type of peel, the better. Really leaving the skin alone a lot for the first 24 hours, maybe even 48 hours. The main thing you might use is arnica to help with swelling, or just easing some of the discomfort, or arnica therapy. Or you may put, if the skin gets extremely dry, you might want to have a little of the post balm. But remember, less is more those first 24 to 48 hours. You've wounded the skin. It's in a state of confusion, and it's starting to heal itself from within. And you don't want to antagonize and put too many topicals on the skin too early. So you'd keep it kind of simple and benign. And so we're going to go ahead and take her eye pads off.
The only thing I do recommend when I teach is that it's just easier if somebody comes in with a button down, so they don't have to pull anything over their face or aggravate their skin. A V-neck or something with a button down.
Absolutely, that's a good point. Even coming in with a hat, so they're not getting any sun exposure. Having some water to offer them so that they can drink water and stay hydrated. Whatever your temperature is outside there. If it's extremely hot, having their car cooled down. Just really avoiding that. And
Of course, no exercise, no hot tubs.
no hot tubs. Well, Susan, you look like a little lobster. You're going to get one heck of a peel. So let's wrap that up.